A serious, emerging, and important area that really, I think, is the most important to many of our patients is it's great to have breakthroughs and science, but we must always have a patient-centered focus. And I'm also a physician treating patients in the clinic every week. And what I mean by that is as we develop novel agents, we also are seeing novel toxicities. We have to keep that in mind for our patients, for their families, when we're developing drugs. So it's not just about the science. We have to think about three areas. One is the toxicity of the novel agent itself, oftentimes eluding the preclinical study and sometimes is only seen when it comes to the clinic. Two, now that we're combining agents, for example, in the MPNs with JAK inhibitors, are there overlapping toxicities? And then three, long-term follow-up. We need to look for long-term infections, second cancers, all of these things, because after all, many of these are chronic diseases. So I think the lessons that we've learned early on in combination therapy is that new toxicities and side effects can emerge, so we have to build our clinical trials to look for it in the short, medium, and long term. And then we have to look at the science to see what other pathways these novel agents are hitting, traditionally called off-target effects, but may be very important for patient toxicity. Finally, I also want to mention our great friend and colleague, Dr. Ruben Mesa, who pioneered the MPN symptom burden questionnaire. It's really an amazing tool because it's been used pre-JAK inhibitor, now into the JAK inhibitor era, and now we're using that same tool in the combination and novel agent era. So it's important to really make sure how are patients' symptoms doing, what new or old toxicities are emerging, and then when we combine drugs, are there whole new areas there?